Good evening, and thank you for joining tonight's Teletown Hall meeting with Congressman Andy Barr. Congressman Barr will be joined by Lexington Mayor Linda Gorton, who will provide an update on the local response to COVID-19. In just a moment, Congressman Barr and Mayor Gorton will begin with a few remarks to give everyone time to join the call. This technology allows people from around the 6th District to join us live to ask questions from your congressman. If you have a question for Congressman Barr, please press star and then 3 on your phone. Again, that is star and then 3 to join the queue to ask a question. With that, I'll turn it over to Congressman Barr first to update us on the federal response to the coronavirus, and then to Mayor Gorton to share about her coronavirus response work in Lexington.
Well, good evening, and thank you, Tatum, and thank you, everyone, for joining us this evening for an important update on both the federal response efforts and the local response efforts to the COVID-19 pandemic. I know this has been a difficult and challenging time for so many Fayette County families and workers and businesses and healthcare workers, and we all certainly appreciate the work that everyone is doing to flatten the curve. And I know many of you are getting used to these teleconferences, and we think these telephone town halls are a good way to continue to practice our social distancing while at the same time give you an opportunity as our constituents to give us your suggestions, your feedback, and ask us questions so that you can be as informed as possible. Before I begin, a few introductory remarks. I want to note that today is National Nurses Day, and I want to thank all of the heroic nurses as well as doctors and healthcare workers who are putting their lives at risk serving others in Fayette County and around the country. Obviously, their courage has been on full display as we fight the novel coronavirus together. And tonight we are very fortunate to have a terrific nurse joining us, our very own Mayor Linda Gorton, who is doing a fabulous job leading our community through this coronavirus epidemic. And we look forward to her comments, and we really appreciate her joining us on the call, and I'll turn it over to her in just a moment. But before I do that, let me just give you a quick update on the federal response. We also want to join in thanking Kentucky's other heroes in addition to those nurses, folks who are going to work every day as police officers and firefighters, paramedics, grocery store employees. Wow, they're really pitching in, and truck drivers, postal workers, bank tellers, they're staying open to process these small business loans, sanitation workers, cleaning crews. All of these folks are doing their job despite the danger the virus poses to them, and we want to thank them. Their sacrifice helps us keep a little bit of normalcy during these times. As you all may know, last month Congress voted, and I supported this, a Paycheck Protection and Health Care Enhancement Act. This was the fourth in 4 phases of legislation. And this fourth phase of the bills that were passed by Congress replenished the Paycheck Protection Program with an additional $310 billion in funding that allocated $60 billion in funding for the Small Business Administration's Economic Injury Disaster and Grant Loan Program. The legislation also provided $75 billion in additional funding to support the work of our hospitals and our healthcare providers on the front lines. And the package also included an additional $25 billion to expand testing to help us safely reopen the economy and make sure we accelerate the diagnostics in our communities. For weeks, we've been calling on our colleagues in Congress to provide additional funding for the PPP program, and we know now that program has saved millions of small businesses from closure and kept employees on the payroll. The first wave of funding, 1.6 million small businesses received loans, including 24,000 loans approved, totaling over $4 billion here in Kentucky, according to the Small Business Administration. And under the second round of PPP funding, there were additional 2.4 million loans for $180 billion, and that means in total, this program, this forgivable loan program, has thus far supported over 4 million small businesses around this country, the backbone of our economy, with over $520 billion in loans. And these are businesses, in many cases, that are intergenerational businesses. They were built with a lot of care, a lot of time, dreams at stake here, and a lot of workers. In Kentucky, the program has provided more than $5 billion in loans to over 42,000 Kentucky small businesses. And these loans are going directly to small businesses through the hard work of our community-based lenders, our community banks, our credit unions. They've worked really overtime to get this cash flow out. We've created a small business response team in our Lexington district office that's available to any small businesses out there in the 6th District who have questions. They're working with impacted businesses and lenders to work with the Treasury Department and the SBA on outstanding issues. So call us if you need help with any of that. And as a reminder for those of you who are just joining the call, you can get in the queue to ask a question by pressing *3 on your phone. You'll be put through to an operator and you'll be placed in line to ask a question. Just to continue my update before we turn it over to Mayor Gorton, I wanted to give you an update on the cases nationwide and in Kentucky. As of Monday, May the 4th, over 1.1 million Americans had tested positive for the disease, over 5,800 cases in Kentucky. At this point in time, Kentucky accounts for less than 1% of all confirmed COVID cases nationwide. That's a good sign. But it's vitally important that Kentuckians remain vigilant and that leaders continue to prepare our state in the event that more cases arise. Since the beginning of the pandemic, we've been working diligently to ensure our hospitals and our medical providers have the supplies that they need for their frontline healthcare workers to continue the fight against COVID. In addition to coordinating 3 shipments of personal protective equipment from the Strategic National Stockpile to Central Kentucky area hospitals, we've also secured guidance from the Centers for Medicaid and Medicare Services that will allow the use of telehealth services in Lexington hospitals that will protect healthcare workers. It will bring modern technology to the patients, and it will conserve critical personal protective equipment, the masks, the gloves, the gowns. We were first notified of this issue by Lexington epidemiologist Dr. Mark Doherty, one of the many healthcare providers on the front lines battling COVID-19, and he told us that if we can use telehealth, telemedicine within the hospital setting using a Bluetooth stethoscope and good old-fashioned FaceTime with an iPad, that they could really save a lot of personal protective equipment and protect healthcare workers. So we worked with CMS at the federal level to get them to recognize that, and they responded to their credit, and they changed the rules so that healthcare workers across the country can use this innovative technology to protect themselves and their patients. We've also advocated for more help for Kentucky hospitals and nursing homes with Admiral John Paycheck, who is leading the federal government supply chain task force at FEMA. And as we begin to reopen our economy, it's really important that our hospitals have those supplies to restart operations to perform elective procedures. And one of the central components to this is increasing our testing capacity. More than 7.5 million Americans have now been tested for COVID-19, with almost 1.1 million confirmed cases nationwide and over 5,800 cases in Kentucky. Last week, the President released the Opening Up America Testing Overview and Testing Blueprint, which is designed to facilitate state development and implementation of robust testing plans and rapid response programs to open up America. This proposal establishes a partnership between federal, state, local, and tribal governments and private sector and professional associations, all of which will play important roles in meeting the nation's testing needs. Since the beginning of the crisis, the FDA has issued 70 emergency authorizations for new tests, including 8 for serological or antibody tests. Congress has authorized and I voted to approve significant amount of funding to go toward diagnostic and serological test development and supply distribution, including that additional $25 billion as part of the bill last week. I also recently spoke with Dr. Tammy Beckham. She's the director of the Office of Infectious Disease Policy at the U.S. Department of Health and Human Services. She's a key federal official coordinating testing and supplies, and we talked about Lexington hospitals and their needs for the rapid throughput tests, and more than that, because we were able to secure 15 of these Abbott lab tests in Lexington hospitals and some of the CFIA tests platforms in Lexington hospitals. What we really need is more testing kits, the supplies. And we talked to Dr. Beckham about that. We conveyed those concerns and the requests from our doctors and our hospitals in Central Kentucky, and she was very responsive, and we think that's going to result in more supplies to our hospitals very soon. So just to conclude, over the past 2 months, we have made tremendous progress in flattening the COVID-19 curve, while we've simultaneously bolstered our medical supplies, and we've given us more time, especially for our hospitals, to prepare and prevent our hospitals from being overrun by the disease. That said, the time has come for our state and our country to begin the process of safely reopening our economy, consistent with public health priorities, and engineer this great American comeback that I know is coming. And for those of you who are just joining the call, you can get in the queue to ask a question by pressing *3 on your phone. And now I will turn it over to our special guest, Mayor Linda Gorton, for her remarks. Thank you so much, Mayor. Happy Nurse Appreciation Day, and we appreciate your time this evening.
Thank you so much, Congressman Barr. Yes, I am a registered nurse, and I had a full career which spanned about 40 years. And, you know, it is interesting that I'm now in a position of leading a city of 325,000 people as a nurse. And it really has helped me a lot because, as you know, nurses are used to looking at, just to put it quite simply, looking at patients, which somebody said, well, the city's a big patient, right? We look at the symptoms and talk about actions and get to the solutions. So I thought I might give our callers just a quick overview of a little bit of the chronology that I've been working with, and some of the things that we're currently doing, and an update on a couple things. You know, you mentioned, Congressman, the last 2 months. It's been exactly 2 months today. It was on March the 6th that we had our first case of coronavirus in Kentucky, and that patient was hospitalized in Lexington. I remember this clear as a bell. It was a Friday night. And so we had already gone into action before that. In February, it was so interesting to look back. In February, toward the last week, I pulled together a group of stakeholders here in Fayette County because I wanted to be sure that if coronavirus came to Kentucky and ultimately to Lexington, we would be prepared. So I gathered about 50 of our main stakeholders from the community, everything from airport director to Lextran director to hospital folks. It was a wide variety to just say, share with the group what you're doing to plan for the coronavirus. And I also invited our council members in and to hear this. And one of the council members told me later, he said, I thought you were stark raving mad to do that in February. And as it turned out, the next week we had our first case. So, you know, the key to all this, as the congressman knows, is planning and moving through your plans. And so my nursing background really helped me because right away I recognized that this pandemic would affect groups in a more in a bigger way. And so the very next week after we had that first case, within 4 days, I had closed our jail to visitation, I closed our senior citizen center, and I closed our nursing homes to visitors. That was very early in the game, and it helped us a lot, I believe, because Fayette County has kept its cases low, and our citizens have done a fabulous job of flattening the curve, that phrase that we're all familiar with now, and we have really stayed low. We've had 9 deaths so far in the 2 months here in Lexington. And so I really credit our citizens with a lot of that hard work in the beginning. So from there, we immediately worked with the United Way and the Bluegrass Community Foundation and established our Coronavirus Response Fund, which was stood up in order to help fund our partners in the community who feed people, who provide shelter. We knew we would need these things, and in this short 2 months, that fund has raised $821,000, and it is providing grants. Every week they've granted money to entities like God's Pantry, which has been feeding hundreds and hundreds and hundreds of people. And they have provided funding to shelters. It's just been a real godsend that we got that up and running early. And then I have had a series of decisions I've had to make since March until today, and I did declare a state of emergency with the very first case, because I understood it would help us get help from the federal government and the state government, and it would also allow me to do things like restrict access to the government buildings and those sorts of things. So right now, some of the really wonderful things that have happened along the way are we had a call to action early in April to our business community here in Lexington, and we had many businesses either donate the personal protective equipment from their stockpiles because they used it in their business, or they turned their manufacturing around and started making it. Add Color is making the face shields. You know that our distilleries have provided thousands of gallons of hand sanitizer that they have made, which I thought was awesome. We've had lots of businesses step up and do those sorts of things. Now, I will say that our citizens, while they've stayed healthy at home, one of the things that happened in March before we started closing things was that it turned really nice. The weather was beautiful. And what happened was our parks and our nature facilities like Raven Run and McConnell Springs were flooded with people. We had about 4,000 people at Raven Run one Saturday. And so what we had to do was close a lot of those facilities. We had to close our playgrounds. They are still closed. We had to close our sports fields and facilities and parks. We closed Raven Run and McConnell Springs. We needed to get control of those places in terms of groups. And so our golf courses closed. And so what we've done, we have a fantastic director of Parks and Rec who has systematically looked through all those and devised ways with her staff to open back up. So this week we opened McConnell Springs and Raven Run. They are by appointment so that we can limit the number of people. Of course, they're free. And then we opened up our golf courses because they put into place a way for people to make tee time reservations and to pay online. We didn't have that before, so that they could avoid face-to-face contact and money exchange. It's all those little things that we were all working on. So golf courses are open back. McConnell Springs and Raven Run are open back. Our focus has been to keep our basic services up and running. Our police, our fire, our corrections, our waste collection, garbage collection, our, all those kinds of things. And we have continued all of that. So in the meantime, I stood up this stakeholder group that met in February as a telephone conference every week. We talk weekly. There are anywhere from 40 to 60 people on there. Weekly, I stood up a healthcare stakeholder group. We talk with our healthcare leaders once a week. I talk 3 times a week with Mayor Greg Fisher of Louisville and Governor Beshear. You know, when you think about it, Lexington, Fayette County, and Louisville have 25% of Kentucky's population. We represent a fourth of the people. So we have these phone calls 3 times a week. They're very helpful to understand what the governor's thinking and for us to take concerns to him. And then I have appreciated so much my collaboration and calls with Congressman Barr. We've done lots of those, and my chief of staff has been on with your staff, Congressman Barr, so that's been helpful. I've had one call with Senator McConnell, and then some members of my staff have been on other calls with the senator. And then I wanted to just quickly say the most recent thing that I have done in terms of standing up efforts to take action are this week, my new coronavirus restart the economy group got up and running. I'm chairing that with Luther Deaton, who is the CEO and president of Central Bank and Trust Company. And we have Mary Quinn Raymer from Visit Lex and Bob Quick from the Chamber of Commerce, who are the vice chairs. And we have several subcommittees representing different sectors in our community, and these are small subcommittees, they're nimble, and they're creating plans for reopening. So we've got a lot going on. I'm so proud of our Fayette Countyans for the work they've done to tamp down this virus here. And the other thing I'll say, and then you might want me to stop. I know we need some time for questions, but as everyone knows, this virus and the actions we've had to take have been devastating for not only state and federal budgets, but for local budgets. And many people in Fayette County are already aware that this current fiscal year, this last quarter, April, May, and June, is our fourth quarter. We are expecting a $9 million downturn in our revenues. And then for our fiscal year 21 budget, which starts July 1st, we forecast that our revenues would be down $40 million. So this, as well as managing the coronavirus, we have had a budget process going on side by side, and so we've had a lot of teamwork on this, and we have put together a budget. It doesn't look like any other budget we've had here in Fayette County, but we are planning to live within our means, and I know that Congressman Barr has been wonderful about linking us in with some information for programs at the federal level where we might be able to access some dollars. So we have a lot going on. The other quick thing is the Federal Medical Center. If you follow the news, you know this week that we've talked a lot about the prison out on Leestown Road. It's what we would call a little hot spot right now, and they have quite a few cases out there, and our goal is to get the employees tested because many of them live not only in Fayette County, but Congressman Barr with the 6th District, many of the employees out there, I think they're around 400 and some, they are in 6th District communities. So we're working on getting them tested, and then we have our 2 test sites up and running. They'll be going a 3rd week next week, one at BCTC, which is for anyone over 18, and then the Walgreens out near Hamburg, which is for healthcare workers, first responders, and those with high-risk factors. We've made a concerted effort to test in our African American community and are so far being really successful. We've worked with the black pastors in the community and their congregations. So we've had a lot going on. I could talk longer, but maybe I need to stop, Congressman.
No, you did great, Mayor. That was fantastic. Great update, and we also have enjoyed working with you and appreciate your great staff, Tyler and everybody on your team. So why don't we start with some questions? And Tatum, I'll turn it over to you for questions for either me or Mayor or both.
Great. Thank you, Congressman and Mayor Gorton. As a reminder, for those of you just joining the call, you can get into the queue to ask a question by pressing *3 on your phone. You'll be put through to an operator and you'll be placed in line to ask a question. Again, that is *3 on your phone. With that, we'll open it up for questions. Our first caller is Stephen from Lexington.
Hey, Mr. Barr.
Hello, Stephen.
How are you doing,
Stephen.
sir?
I'm well. How are you? Hope you're well.
Oh, I am. Family is too.
Good.
I just had two questions, if that's okay.
Sure.
One, since the beginning, since the beginning of the year, I've been hearing asymptomatic all over the place. What all does that actually mean, and is it a certain age group? And the second question is, do you think it's too soon to open or just the right time? And businesses that are opening, do all of them have to take these steps, like temperature check? And if some don't, what do you do?
Well, great questions, and some of those are medical questions, and so I'm only going to be able to repeat what the doctors have told me. And on medical questions, I should defer to the mayor, as she is a medically trained and I am not. So we'll let her take a stab at this as well. But what I will say is that I've made it a point to daily, and sometimes even more than daily, communicate with the healthcare experts in our own community. Of course, we've had a chance to interact and ask questions of Dr. Fauci with the National Institutes of Health, who is the leading infectious disease expert in the country, and he visits with members of Congress regularly. Dr. Birx, who's leading the White House Coronavirus Task Force, and I've had a chance to chat with her, Dr. Beckham at HHS and others. But here in Lexington, I routinely talk to the epidemiologists at Baptist, at UK, at St. Joe's, and Dr. Mark Doherty has really been a go-to for me. And what he has told me is that, yes, this, especially in the early stages of the disease, this can be an asymptomatic, which is what has made this so contagious, because people don't know that they have it, and they can still be shedding virus and spreading virus. And so what that means is that reopening will require us to continue, and reopening safely will require us to continue to practice social distancing, hand hygiene, washing hands, not touching your face, and then importantly for reopening the economy and reopening businesses safely, not only utilizing and taking advantage of the much improved testing availability for those employers who need that as they reopen, but also masks. And so this is something that I don't think is necessarily mandatory. Maybe, may not be. I'm not sure. That's up to the local and state officials. But it is something that I can tell you that doctors are highly recommending. It's cheap. It's safe. It's a way for you not necessarily to protect yourself as much as to protect others. And as we open up into these phases, and the federal government has issued guidelines on reopening. It's called guidelines for reopening, and there's 3 phases to this. Certainly in the first phase, it's recommended that people get a hold of some masks and put those on as you go to work and as you go into public, especially if you cannot stay 6 feet apart from others. And that will enable us to protect others even as we are asymptomatic. And final point, and this is, I'm only speaking for myself here, as I understood the early the early efforts to close down our economy, and we did so. The federal government issued those guidelines. The 30 days to slow the spread were these guidelines that urged the state and local governments to enact these quarantine measures and stay-at-home orders. That was designed to slow the spread and to build up the resiliency of the healthcare system. It was never understood at the outset that we were going to be able to defeat this virus entirely within 30, 45, or 60 days. We will only defeat the virus with a vaccine, which we hope will come within a year, but it may be even a little longer. The good news is there's a lot of therapies that are in development, antiviral therapies, and even vaccines that are already in clinical trials with human testing that's happening right now. Johnson & Johnson, Pfizer's doing that, other pharmaceutical companies, and so we're making great progress with that. But the goal of the shutdown of the economy was just to give us time to build up resiliency with the testing and with the personal protective equipment. And now we are entering into the place where we've flattened the curve and we're moving slowly and safely to that place where we can start to reopen the economy. So that's where we are. And I think if you listen to the epidemiologists, that's what they say is as we reopen and as we continue to use social distancing and masks, we can reopen safely, even with asymptomatic people. Mayor, would you like to touch on that a little bit?
Well, I think you did a great job. I did want to point out to Stephen's question about being asymptomatic. As this virus has progressed, they've learned that there are other symptoms, and they've added to the list of symptoms. In the beginning, it was fever, cough, and shortness of breath or difficulty breathing. Now they've added headache, chills, aches, and sore throat. So the list of symptoms has expanded. And then back to Congressman Barr's point about in the beginning, the other fear was we saw what happened in some of the other countries. The healthcare systems got totally overwhelmed because there was really, I would say to your point, Congressman, about distancing and staying at home, a lot of that also helped our healthcare facilities not become overwhelmed. And that was also key in the beginning.
Exactly. Well, thank you very much for the question.
Okay, our next question is from Gwen in Lexington.
Hello, Gwen.
Hello. My question is, I haven't received my stimulus check yet, and I was wondering what is the status and why we haven't received them. I'm Social Security age, and a lot of my friends and relatives are that age also and have not received theirs either.
Thanks for the question, Gwen. And for Social Security beneficiaries that typically do not file a tax return, they would not necessarily have received the automatic deposit because those went to folks who filed a 2018 or 2019 tax return. What the Social Security Administration and the IRS are telling us is that Social Security beneficiaries will be receiving those payments, those economic impact payments, the $1,200 per individual, $2,400 per couple, in the same manner in which you receive your Social Security payment, whether that's in a physical U.S. mail format in a check, or if you have a direct deposit in your bank account that same way. We were told about 2-3 weeks ago that those will be deposited throughout the next few weeks, and that most people would have received them by the middle of May. So my suggestion to you is that if you do not receive it by the end of this week, don't hesitate to call my office, and Our number here in the district office in Lexington is 859-219-1366, and this is for you, Gwen, and anyone else on the call. Please call us, and we can help make sure you get it. Make sure we check your eligibility and make sure you get it. If you meet all of the criteria, we can work directly with the IRS and the Social Security Administration. If you do not receive it, say by the end of this week, in the same manner in which you typically receive your Social Security payment.
Okay, our next question is from Bill in Lexington.
Thank you very much for taking my question. There's been an outbreak of COVID-19 at the Federal Medical Center here in Lexington, Kentucky. I believe there have been 55 positive tests so far. There are over 1,000 inmates, and when you count the employees, there are probably close to 2,000 people there. It's my understanding that the Federal Medical Center has not been very cooperative or has not been communicating well with Mayor Gorton and with Governor Beshear, and I'm concerned about that problem and its possible effect on the spread of the disease in Lexington and the 6th District, and its effect on perhaps overwhelming hospitals in the area.
Well, thanks for your concern, and I share it, Bill, and I'll let the mayor touch on that first.
Thank you, Congressman. Bill, thank you so much for your question, and you are absolutely right. However, since this issue became highlighted in the media, the first thing that happened this morning is that my chief of staff did get a call from the warden out at FMC, and they had a very good conversation. And what we wanted to convey to them is that we had a great concern about the employees, most of whom are our citizens right around here and in the Congressman's district, and we want to get them tested. And so the warden is working with us and with the Fayette County Health Department, and we're working on a plan to get those folks tested. We're going to be putting out in our social media where the employees can go to be tested. And any of them, they don't have to have symptoms or anything. They just have to be over 18, can go to the testing site that Kroger has up and running at the BCTC campus on Newtown Pike. They will have to register at KrogerHealth.com. They do not have to have symptoms. It's just they have to register for the appointments, and they have next week is the third week that they'll be testing. So we finally have some better communications and are, I think, in a much better position with them out there now. So thank you very much for asking about that.
Yeah, thank you, Mayor, for your leadership on that. And Bill, thank you for the very legitimate concern. And the Mayor and I spoke earlier today, and I've offered to reach out also to the U.S. Bureau of Prisons and make sure that they're aware of the situation, and we get that situation under control as much as possible and bring to bear any federal resources that we need to there.
Okay, our next question is from Sandra.
Sandra,
Hello.
Good evening.
Hi, Andy. How are you?
I'm well. How are you doing?
I'm sorry if I may call you that. I'm doing well.
Oh, that's fine.
I'm kind of one of
Please
those
do.
people who suffers from anxiety, panic. My husband is a subcontractor who installs floor covering for a business in Richmond, Kentucky. We are trying to get back up and running as small businesses do. We don't have 401ks or paid vacations, anything to that nature. I'm wondering, what do we need to do as far as getting back up and running? I've checked into the loans as far as small business loans. Are they truly going to be forgivable? And if not, how long will we have to pay back these loans? Because we're one of these people that literally do live paycheck to paycheck.
Great question, Sandra. And yes, the way we structured this Paycheck Protection Program is that it is available as a forgivable loan not only to employers with employees, but also to independent contractors and sole proprietors and self-employed people, I believe like your husband. And so what I would recommend is go to a bank, or a credit union, wherever you all typically go, and by the way, you don't have to have a existing banking relationship. There are a number of lenders in Central Kentucky and Lexington that are participating in this program, who are taking and originating loans for people who have not previously banked with those institutions. So you are, and your husband, as a self-employed person, is eligible to receive one of these forgivable loans. The amount of the loan is if it's just your husband, it would be just what his payroll would be for a period of 1 month based on the prior year's earnings. So he would need to show what he earned in an average month in 2019 to show what he should get on a monthly basis over the course of 8 weeks. So that the amount of the loan is 8 weeks worth of compensation, and if the proceeds of that loan is used for payroll, anything that you pay for, your compensation that you pay yourself, that your husband would pay himself, plus any health insurance that he would pay for, which would be part of the payroll, and any rent, any utilities related to the business, and there may not be rent, or there may not be a mortgage related to the business if he's self-employed, if he works out of his home, but anything like that. And as long as 75% or more is used to pay the payroll for those 8 weeks, then whatever you pay yourself over those 8 weeks, plus the additional overhead, would be completely forgivable. And your lender can help you make sure that what you take out, you know what portion of it is forgivable and what would not be. If there is any portion of your loan that's left over that's not forgiven, the term is 2 years on that at a 1% interest rate, so an ultra-low interest rate. Again, payable in 2 years with a 6-month deferral, so you don't have to start paying on it until 6 months from the origination of the loan, although the interest, the 1% interest, does begin to accrue at origination. So that's what you need to know about it. And yes, indeed, self-employed people like your husband would be eligible for that. And it's designed for self-employed people so that you don't have to go to the unemployment office, which is very, very difficult to navigate right now just because so many people are trying to get unemployment.
Okay, our next question is from Bruce in Lexington.
Good evening, Congressman.
Good evening, Bruce. Hope you're healthy.
Well, physically maybe, mentally I'm not.
Yeah, I'm sorry. It's been tough to have everybody.
Yeah, it's been a tough
isolated.
30 years. I want to know why our country is relying on a murderous communist dictatorship.
And I assume you mean China on that.
Duh.
Yeah.
Yes, sir.
Well, I share your concern, and I introduced a bill. Working with some of my colleagues, obviously, we've all been looking into this since well before the coronavirus, knowing full well of the malign conduct of the Chinese. In fact, in the last Congress, I worked very closely as the chairman of the subcommittee with jurisdiction over foreign direct investment. We significantly strengthened the way in which we scrutinize and review malign investment from China. the way that China would invest in businesses and steal intellectual property and force the transfer of technology. In this Congress, of course, we're looking squarely at the origins of this pandemic and China's mishandling of it. The Wuhan Institute of Virology as a potential source of the pandemic, whistleblowers like Dr. Li Wenliang, who, of course, died of COVID-19. He was a whistleblower and was arrested by the Communist Party in China and forced to recant as he was trying to warn people of this. The Chinese Communist Party's campaign of disinformation, their denial of human-to-human transmission, and they manipulated the World Health Organization to repeat that lie. The list goes on and on and on, but I think most sinister of all is the fact that they then weaponized the supply chain. They vacuumed up and they hoarded all of this critical PPE and pharmaceuticals, and we even have a case where we know that a top Chinese Communist Party recently threatened to withhold critical antibiotics and sedatives and other drugs from the United States, and was said to, it was reported that he said he was threatening to throw the American people into an ocean of coronavirus. So we know we've got a lot of work to do on this. I introduced a bill that now has almost 70 co-sponsors in the Congress that would establish a bipartisan, bicameral committee to investigate the origins of the disease in Wuhan and also China's cover-up. And I am also had a conversation with the House Minority Leader, Kevin McCarthy, who has discussed a strategy with me on the way in which we're going to report out recommendations for some policy changes to relocate supply chains and decrease our overdependence and our dangerous overdependence on China for generic drugs and other critical medical supplies. So we're on it. We know it's a big issue, and obviously we have a lot of work to do to decrease our dependence on the Communist Party in China.
Okay, our next question is from Kay in Lexington.
Thank you for taking my question, and I would like to direct this to Mayor Gorton. My question has to do with testing, and I do not have any symptoms, so I'm wondering, people like me that do not have any symptoms, if we should wait to be tested until we do have symptoms. And the part B of my question is, maybe I missed this when Congressman Andy Barr was talking, but I wanted to know more about, do they have the saliva test in place?
Hi, Kay. This is Mayor Gorton. Thank you so much for calling. And what I would tell you about the testing, if you don't have symptoms, we're encouraging people who don't have symptoms, if they feel like they want to test, to go to the BCTC site. That's the Kroger site. And of course, we all know and understand that just because you don't have any symptoms doesn't mean you are not positive, because you can be asymptomatic like we've talked. So I encourage people, if they feel like they want to go tested, there's no cost to it. There are no requirements at the BCTC site, except you have to be over 18. And you do need to register because they take appointments. And so what you would do is go to KrogerHealth.com and sign up. So I think it's a wonderful opportunity. They are trying to test about 350 people there per day, and they've had when they've done these tests, they've had a positive rate of about 5%. So they are identifying people who are positive, who are symptomatic, and who don't have symptoms. So I would encourage you, if you feel like going, to go. It's drive up only. And as far as the saliva tests, Congressman Barr, do you know the latest on that? I'm not familiar with whether those are being used.
There are some saliva tests that are in development, I know, and there's also, in addition to the saliva test, there's also, and I've spoken to a company that has been long been in the diabetes testing space, and so there are some other companies that have submitted tests to the FDA for approval, and of course they have to validate the reliability of these tests, so it's not automatic, but both saliva testing companies and also blood tests that are similar to the quick test that a diabetic would use, a quick blood sample put on a strip to diagnose whether or not, so there's many of these faster throughput models that they're testing out. What I will say from the federal level is that the FDA, which has been the target of criticism for being too slow on some of their response, I will have to give the FDA credit in that they have issued over 70 emergency use authorizations for diagnostics over the last 60 days. That's really unheard of from that agency. 8 of those are serological tests, which mean they are testing antibodies, whether or not there's some level of immunity, that the individual may have already had it and developed some kind of antibody. So the testing situation is getting better, both in terms of the private sector developing it, in terms of the FDA approving new testing, and then, of course, Congress has appropriated, with my support, a whole lot of support to accelerate this, more money to the FDA to help the private sector, and money to an agency called BARDA, which is an agency of the federal government within the Department of Health and Human Services that partners and collaborates with the private sector, provides funding to private sector companies to rapidly develop more testing, and then to deploy testing and to develop more of the testing kits, or the supplies, the swabs, the reagents, the trays that are required. And as a result of all of this effort, and I know testing has been a sore subject and a subject of legitimate criticism, but I am happy to report that now more than 7.5 million tests have been performed in the United States, which is more than any other country. Not more per capita, but more overall. And the rate is getting much better. So yesterday, according to the COVID Tracking Project, 260,000 tests were reported in one day. That's the most we've ever seen. So we're looking forward to that improving locally as well. One final point, and that is we're trying to surge some of the testing to our local Lexington hospitals. So I've been in contact with Baptist Lexington, UK, CHI St. Joseph's, and what their needs are. We've given those needs specifically to Dr. Beckham, who's leading the testing project at HHS. And what we have stressed is that we're doing pretty well, especially if you talk to UK. They've got a machine over there that does a lot of volume, what's called an M2000 test, and they can do a whole lot of testing. But what we do need more of is the testing kits for the Abbott lab tests. We were able to secure 15 of those platforms for Kentucky hospitals, and we have several in our area. Frankfurt, a couple in Lexington, I think one in maybe Georgetown as well. But we need reagents. We need the kits for those, and so we stress that. And we also, there's a CFID machine over at the Baptist Lexington Hospital, and we've asked for more of the kits for that as well. So I think this is going to get better as time goes on.
Okay,
Thanks,
our last question for tonight comes from John.
Thank you. Congressman Barr, I'd like to know your opinion regarding what the long-run impact will be from all the debt that we as a nation have incurred.
John, thanks for the question. I share your concern about this. We have, over the last 4 to 6 weeks, gosh, I think it's now 6 weeks, time flies, but 6 weeks in these 4 phases of federal legislation, we have incurred approximately an additional $3 trillion added to the national debt just in the last 6 weeks. So our deficit this year, because of the pandemic and because of the pre-existing deficit, will be $4 trillion. We're pushing $24 trillion in total national debt, which for the first time since World War II now exceeds the entire gross domestic product of the country. That is a big problem. As you know, if you followed my career in Congress, I ran for Congress to address the national debt. It's been very disappointing in my 7 years in Congress when we vote for bills to cut spending or we vote for reforms of programs and we're in the minority and we don't get the job done. And of course, then this happens and it's exacerbated even further. I will tell you, I was on a phone call yesterday with the chairman of the Federal Reserve, Jay Powell, who is in charge of the Central Bank of the United States, and we asked him very directly about the impact of the growing debt as a result of our response and what his views were. And I do respect his opinion, and he did say, as he always does, that over the long run, this is a big problem that we need to confront. He did, though, stress that at this point in time, at this moment of a national emergency, the priority should be economic relief. And to make sure, because what he said was that the cost of allowing these small businesses, millions of small businesses across the country, which would, without these forgivable loans, would not only disappear, but in many cases disappear permanently, that the economic damage and the long-term negative impact to economic growth would be so negative that the priority right now needs to be to provide emergency economic relief for these folks. But the overarching point that you make, John, is a very good one. It's a concern that I share very much, and that's why I believe that it is important that we safely begin to reopen this economy, because no amount of stimulus checks or forgivable loans or unemployment insurance can take the place or replace getting the economy open again, getting taxpayers back to work to rebuild our tax base. And by the way, not just for the federal government, but for Lexington, Fayette Urban County government, for the local tax base as well. And I know the mayor would want to mention that as well. So we need to reopen the economy safely, consistent with public health, because this situation of continuous borrowing is definitely unsustainable. And then after we get out of this, we're going to roll up our sleeves and continue to get back to getting to the point where we can balance the budget. And I'm working with a bipartisan group to require a fiscal state of the nation by the Comptroller General of the United States. Because I think just like we have a State of the Union address every year, we should have a fiscal state of the nation by an independent person who just gives the American people the facts about what this means. And what it does mean is that as we pay more and more interest payments on and debt service, that means less we are able to use tax dollars, hardworking Americans' tax dollars, on critical things like national security, homeland security, law enforcement, education, research, and other priorities that we have as a country. So with that, let me turn it over to Mayor Gorton for her comments on that, if she wants to comment on that, and Lexington's finances, and then any final comments that you might have, Mayor, about what's going on in Lexington's response to this situation.
Thank you very much, Congressman Barr, and I really appreciated John's question, that last question, because the financial impact on, as you said, on not only our country, but our Commonwealth and our city here in Lexington has been tremendous, and not in a positive way, but the assistance that businesses, small businesses, and contractors and unemployed folks are receiving, I think, is the lifeline to get them through this, like you said. That was the first priority. Now, the next one is, as you say, getting us open back up and getting our economy humming again. And so I'm working really hard on this. We're taking it very seriously, and we're being very intentional about this opening so we can do it safely. And, you know, our economy here in Lexington was rolling. Our unemployment was 3% in January. So we've all taken a hit, but we're, you know, our people can do this, and we will help them do this. So I just so appreciate your having me on with you, Congressman Barr, and appreciate all the folks who were on the call tonight. So thanks for the opportunity.
Well, thank you, and thanks again for the collaboration with us. It's been important that federal, state, and local governments work collaboratively, and we have done that, and I really appreciate everything that you're doing. And thanks for joining us tonight and lending your expertise and helping to inform our mutual constituents. And also I join the mayor in thanking everyone on the call. And I know that we had a number of people in the queue who wanted to ask questions and who were not able to, but you will have an opportunity at the end of this call to leave a voicemail for us. And if you need any help with any of the response efforts, whether it's an economic impact payment or if you need access to services that are available, please leave a message so that we can get back to you. We very much appreciate your participation in the call tonight. And again, we encourage all of our constituents to continue good health practices for themselves and their families. And thanks again for joining us tonight and for the privilege of representing you and fighting for your interests. And I am optimistic. The mayor was telling me earlier today she is a true optimist. And we believe that the world is very fortunate to have America leading this fight against the COVID-19 virus, because there is really good news out there in terms of what our researchers and scientists are doing, not just in terms of diagnostics and antivirals that are in development right now, and the plasma therapy that our doctors here in Lexington are pioneering, and the remdesivir, which is reducing the time that COVID patients have to stay in the hospital, but also the fact that we have multiple vaccines in development right now. It's just really, really promising that so many Americans are working overtime to find a way for us to get through this in the long term. And we will get through both the healthcare emergency and we will get through the economic distress that we're in right now. And I believe that on the backside, we're going to be a stronger and more resilient country. So thank you all very much for joining tonight. And again, thanks for the privilege of getting a chance to represent all of your families. Have a good night.
Thanks so much. Bye-bye.
Thank you. Bye-bye.